Well, you may recognize this young lady from every month. She's on our Expert Alert on WLOX Facebook and on social media. Sunny Elmer, who is with Integrated Medical here on Pass Road in Gulfport. How are you?
Sir. I'm good. How are you today?
I'm wonderful. Good. Thank you very much. We wanted to come over here and kind of show you up close and personal some of the things that they do, some of the things that they deal with, and the services they provide. So I'm going to ask you, if you would, again, to just talk about some of the things that y'all do here.
All right, so again, we are family practice. We do focus on regenerative medicines. We do our knee injections with a gel-based substance. We offer sexual health without it being non-invasive. We do hormone replacement therapy without using synthetic medications. We also do your basic primary care needs. If you have high blood pressure, come see us. High cholesterol, if you need some labs done, just a wellness visit. We do CDL license. So any basic medical needs as well. And we always try to go above and beyond your regular medical treatments. So we're available.
Y'all still do COVID testing?
We're still doing COVID testing.
Okay, I had someone asked me that the other day. I don't know if y'all still did it.
We're still doing COVID testing. We are waiting on our vaccinations to come in. So we'll be doing vaccinations here soon. So I think right now it's all first responders and certain age groups, but hopefully they open it to, you know, the public.
I think they've opened it right now to, like, in Mississippi, it's like 16 and above.
Oh, 16, okay.
Yeah, 16 and above that they're letting do, but of course it's hard for a lot of people to get appointments right now.
So we're available. We're just waiting on them. We're just waiting on them to give us a few.
Yeah.
To share.
Now you mentioned the CDL. What type of, you know, is this like a physical or something they have to have done?
It is. So the truckers that are driving the 18-wheelers, or just in general, people that drive for their businesses, they require a CDL physical in order to get their CDL license. So we just got approved to be able to do that here. It's a little bit more to where you have to do an actual eye exam to stand that width apart from, you know, looking at the screen with the letters on it. It requires Brandy to actually see you physically, get some blood pressure on you, make sure you're healthy, good to go, and you don't have any problems driving.
Y'all do drug tests?
We do drug testing. We have stared doing that here. So
I'm sure there's some employers out there.
Oh yeah, that would want to do that.
Want to do drug testing. So there you go. If you need to do that, you mentioned about knees. What kind of things do you do for knees?
So we are offering an injection. It's a gel-based substance. It's hyaluronic acid. So that is injected into the joint space. We have our nurse practitioner, Brandy Parker, that does our injections here. So she'll be in to talk about exactly what she does, how the C-arm works, and what the injections actually involve.
Brandy Parker, nurse practitioner, how are you?
I'm good.
Thank you for being on the show with us and explaining this X-ray unit that y'all use for people that are having knee issues. Tell us about this.
Yes, this is called the C-arm, and what it does is it does a quick X-ray of the knee, and we use that to actually find the spot where we actually go in and we do the Genvisc injections. Genvisc is a hyaluronic acid that we put into the knee, and it helps basically give some cushioning in the knee. So you have something for the bones to rub against, so they're not rubbing against each other, which is what causes the pain in the knee with osteoarthritis. We see many, many patients each week that we give these injections to. We have a 93% success rate.
Wow.
Yes.
That's awesome. And this is my knee that you're looking at.
Yes, this is
What's
your
your diagnosis there, Doc?
I think you look good for your age. You don't have really any osteoarthritis. You've got a nice little joint space in there, so.
So I'll be kicking for a while.
You'll be kicking for a while.
So one of the other things that they have here that's doing wonderful work is called the Z-Wave. You might remember when Sunny talked about that on Expert Alert here recently. So let's find out more about what the Z-Wave is here at Integrated Medical on Pass Road in Gulfport. Now, this is the Z-Wave, the Zimmer unit that you've talked about on Expert Alert. Tell us a little bit more about this.
So we use our Z-Wave on cellulite, and we also use it for erectile dysfunction. What it is an acoustic wave therapy, so it targets the sites of concern. As far as cellulite goes, what it is it's actually trying to decrease the fat in the leg and bring back the elasticity. So I'll show you kind of how it works.
Okay.
And you let me know if it's painful or not, because it's non-invasive. Even with the erectile dysfunction, it's easy, it's quick to do, but it works. It brings back that circulation to areas, which promotes healing.
We kind of tested this on me before we came in here and shot this, so I know what to expect. I'm not going to have anything.
So it's very loud. It sounds like it'd be different than what it actually feels like. So let's go ahead and
Go right
do
ahead.
a little pass. All right.
Okay.
So this is our wand here, and it's just we could do it over clothing for cellulite as long as it's smooth and
Tight.
fairly tight fitting. So with that, we do, at least for cellulite, it is 3,000 pulses. So that's pulsing every less than 15 seconds. So with the cellulite, it's about 3,000 pulses. Sort of the same with ED. We do kind of, depending on the circumstances, either we can go a little higher with the hertz or the joules, but not painful.
No, it's not painful at all, and I guess it stimulates all that. Now, we've actually shown during Expert Alert some pictures of the back of her thighs and the difference between before and the after, and it's absolutely amazing.
Yes.
Absolutely amazing.
Even after, in general, the first treatment, you'll just feel the elasticity change a little bit after the first one. The same with erectile dysfunction and cellulite. You want to be consistent. Good water intake. You want that blood flow to come back to any area that we're doing this on. So consistency is key.
Can you do it for the belly?
We're working on that. We're working on that.
Because that would definitely be non-invasive instead of doing the regular liposuction or anything.
There are studies of acoustic wave and decreased belly fat, but we are working on that.
And this is what it's called, the Zimmer, the Z-Wave.
The Z-Wave, yes.
Okay. So if you'd like any more information on this or any of the other services that they do provide here at Integrated Medical, call the number on your screen.
Yes, sir.
You can go to the website and check out some of the things. They're located here on Pass Road in Gulfport, just about a half a mile west of DeBees Road, right past the subway. So anyway, come check them out. It's Integrated Medical. They're located on Pass Road in Gulfport. Can give you some relief in so many ways: your knees, your cellulite, erectile dysfunction, and so much more.